Hi, everybody. This is Ashley Stelly. I've been a nurse for a little over 14 years now, and this is my plan for the community. It was education regarding just the importance of medication reconciliation with all doctors. So here we go. Community Plan for Education Implementation of the Importance of Medication Reconciliation by Ashley Stelly. Introduction. Unless you work in the medical field or have a family member that does, the likelihood that you know just how important it is that your doctors know exactly what medication you take, whether they are prescribed or over the counter, is low. As medical professionals, it is our job to inform the community of how important it is for our patients, parents, spouses, etc., to know what medications they are on and for those they are caring for. Definition of the community. If anyone from out of town walks into Cecilia, Louisiana, they would really not think much of this very small community of only 1,980 people. Bonami Pharmacy is the only pharmacy and also serves as a gift shop where Miles the pharmacist knows most of his customers by name. Gumbo, boudin, cracklins, and boiled crawfish are by far the favorite foods of this area, but are not the best foods for you. Just describing these foods can give you some insight that heart disease, hyperlipidemia, obesity, or hypertension are some of the top medical diseases for this community. Ensuring a healthy population only aids the medical professional community, which allows more effort to be spent on primary and secondary preventions rather than tertiary ones. Nurses are trained to provide care, but before that training, they were already naturally born to give a part of themselves to others who are in need, which makes nurses one of the best group of people to supply communities with ways to better themselves holistically. Medical availability. There are no doctors, dentists, nurse practitioners, physician's assistants, or clinics within the community limits. To receive medical treatment, everyone must travel to Burbridge, Henderson, or Lafayette for any and all medical care. There are no social offices in the community of Cecilia. Should these services be needed, a trip to Lafayette would be required to meet with a specific type of social worker or case manager to resolve the issue at hand. Welfare and social services offices are located in Lafayette, but the closest WIC office is in Rayne, Louisiana, which is about 40 minutes away from Cecilia. Lafayette supplies the residents of not only Cecilia, but most of the surrounding parishes with hospital care, since there are 5 large hospitals located in Lafayette alone. Women and Children's Hospital specializes in deliveries and pediatrics. Lafayette General Medical Center is a large, newly renovated Level 1 trauma center. Our Lady of Lourdes is a brand new facility with experienced surgical teams performing innovative cardiac procedures. Regional Medical Center is the smallest of the hospitals, and the University Medical Center, which until recently was the only state-run hospital in Lafayette. Vital statistics. Women are the dominant sex in our community, but not by a large amount. There's 1,028 women to 952 men. And there are more Caucasians, which 1,161, than African Americans, which there are 751. To other races, which are only 68. The community age ranges are generally balanced, with a stable number of young, middle-aged, and older adults in the community. In 2010, the Louisiana Department of Health recorded that 673 live births were recorded in St. Martin Parish, which is a low number compared to East Baton Rouge Parish delivering 6,904 babies. In 2013, the Louisiana Department of Health produced a vital statistic fact sheet which stated that there were 62,913 total births in the state. As far as the rate of death in Louisiana, The 2013 LDH statistical fact sheet stated that a total of 43,076 people passed away. Of this large number of deaths, 559 of them were infants, reported by the 2013 LDH. In 2014, the Louisiana death toll rose slightly to 44,172, which 519 of these were from St. Martin Parish. Heart disease is the leading cause of poor health conditions in the parish, with a 36.9% prevalence among Medicare beneficiaries alone, while the U.S. average is 26.2% and the state average is 33.2%. Smoking or chewing tobacco contributes to a decreased health status, especially in patients with heart and lung disease. St. Martin Parish has a smoking rate of 20.4%, while the national median is 17.3% per U.S. News. Even back in 2013, the LDH stated that the leading cause of death in Louisiana was due to cardiac disease, while malignant neoplasms were the second leading cause of death. Most Louisiana parishes have a higher than average overweight population. St. Martin Parish has an obesity prevalence of 34.2% in 2013, as stated by the Data USA. Research shows that Louisiana's population as a whole increased its obesity prevalence from 2012 to 2013 by 33.3%. Cecilia, along with the rest of St. Martin Parish, has a high population living with cardiac disease. The elevated instances of obesity and tobacco use in St. Martin Parish only contribute to poor cardiac health of the community. The CDC classifies both obesity and tobacco consumption as unhealthy behaviors, which is one of the 3 risk factors for developing heart disease. While a person cannot change their familial medical history, they can choose to live a healthier lifestyle by not smoking, eating a healthy diet, and exercising regularly. Nursing diagnosis. The official nursing diagnosis for the community of adults who take medication or manage medication for others is ineffective health management due to inadequate medication reconciliation among the adult population in the community of St. Martin Parish, which is related to minimal fundamental health and medical education programs that explain the process of disease, specifically etiology, medication management, reconciliation, and treatment of diseases such as hypertension and obesity. When a patient presents for an appointment, the handout can then be given, which they can read while waiting for the provider. Any questions regarding the handout can be addressed with the providers, and if any medical interventions are necessary, they can then be addressed at that time. If patients call with questions regarding the handouts, the nurses will be well equipped to answer any questions he or she may have. The pharmacy staff can also continue the education process of ensuring the patients fill their medication on time at only one pharmacy and answer any questions about medications that the patients may have. The handouts will also be present in the waiting room for those family members or friends who accompany the patients to their appointment. The physicians will also be made aware of the educational form via email, and should they have any questions, I will be happy to answer them in detail. The handout. This is the back of the handout. It is a trifold design that can also be utilized as a medication list that can be folded up and placed in the patient's wallets. Obviously, for those patients that are not tech savvy and don't want to use an app or get a list from their pharmacist of that sort. The front is not knowing your medications could be life-threatening. And the back, they have a list of where you can put medications, the strength, how to take the medicines the doctor prescribing, and even put an example there. That way patients can copy that example even if they didn't know what the strength and how to take it meant. Medication allergies and the reactions were also placed in there, since that's important information, along with the pharmacy name and the number, and at the bottom the patient's name and date of birth so they know who the form belongs to. The inside area of the handout presents all of the information about the importance of the medication reconciliation process. The content was carefully chosen to not exceed a 6th to 8th grade reading level to ensure all members of the population could read and understand the information. Inside the pamphlet, it goes over knowing your medications, even listing examples of those medication errors or interactions, and several ways on keeping track of your medications. In the pamphlet, it states, knowing your meds. All medications, whether prescribed or over-the-counter, can cause side effects, develop interactions with another medication, or even intensify certain medical conditions. It was important for me to instruct patients that not only are prescribed medications that you should tell your physician, but also any over-the-counter medications like herbs and vitamins and such. It is not only important to know the name of the medication, but also the dosage. For example, milligrams, units, mils, etc., and how many times a day that it is prescribed. Be aware of your medications when you pick them up from your pharmacy to ensure that you are getting the right medication the doctor wanted you to have. Multiple steps are taken when prescribing medications, and with that, human error could prove life-threatening or even deadly if a medication error goes unnoticed. It is always okay and your right to ask questions about medications you are not familiar with. I don't think that patients are aware of the several steps that has to happen from the time the doctor prescribes the medicine to when they get it. So this was kind of their way of getting informed of those multiple steps that also can incur error. High blood pressure is one of the leading medical causes of the community, and there are several types of medications to treat this disease. Ensure you know which medication your doctor prescribes you, so verification of that medication can be reviewed with the pharmacy. The wrong high blood pressure medication could be life-threatening. And this is something I don't think patients realize, is that just there are multiple classes of medicine to treat one disease. So one blood pressure medicine doesn't treat it the same way a different one does. Examples of errors. Your doctor just changed your medication because the old one was poorly affecting another illness you have. The pharmacy accidentally gave you your old medicine instead of the new medicine your doctor just prescribed you. Or you are scheduled for a procedure and forget to inform the doctor that you're on a blood thinner. This could prove deadly if not known. And there are many medications that cannot be combined, as these combinations may be life-threatening or even fatal. So just letting the patients know this, because some of them may not even be aware, hopefully will get them to manage their medications or know their medications better. And then several listing of how to keep track of your medications, just simply keeping a list of what you take, or bringing the medications in their original prescription bottles to the appointments. If you don't feel like making a list, or if it's hard for you to read or write, you can use phone apps such as like Pill Monitor, MediSafe, MedManage, or QCO, or one of your choosing. Pharmacies also have their own apps which can manage your list of medications, and some of these apps you can even request refills from. You can obtain a copy of your prescribed medications from your pharmacy. And with this, it helps if you only fill at one pharmacy. That way you can get an accurate medication list. And then obesity is another medical condition affecting our community, causing a rise in high blood pressure along with other diseases. Multiple medical conditions can increase the need for more medications to treat these diseases, therefore putting patients more at risk for drug interactions and side effects, which makes knowing your medications critical. So also touching on people who have multiple comorbidities or multiple diseases, obviously mandates the need for more medication. So kind of touching on more diseases equals more medication, which could increase your risk for drug-drug interactions or drug-disease interactions.